which will have potentially a deeper impact on children. So what are you going to do to improve your immunity? Are you taking the zinc tablets? And are you popping the LIMC, vitamin C and multivitamin tablets? Or are you drinking some immunity boosting products? Everyone seems to be doing this, and immunity is the new Indian obsession. India has vaccinated total of 19.50 crore people till today, and in this phone-in program, you can ask your questions and we take your queries live. Today we have with us Professor Dr. Chintamani, Head of Surgery, VMMC, Safdarjung Hospital. He's also the President and Governor, American Colleges of Surgeons, Advisor, Royal College of Surgeons of Edinburgh, UK, and President, Asian Society of Mastology. Namaste, Dr. Saab, and welcome to India Science. Many thanks for joining us and taking time out to be with us today.
Namaste. Thank you very much for having me.
Sir, tell us about the B1.167 strain and why the fatality rate is not coming down even as we see a slide in the numbers. What is it that the number of fresh cases are lesser, but yet the death rate is very high? This is my question to you before we take on the questions from the viewers, sir.
Yes, and a lot of talk about it and around it. So this is the so-called the Indian variant that a lot of people talk about. Earlier we were talking about UK variant, and we've had all variants. Now this is not exactly a very different strain, but it's more infectious, and it is believed that the virulence would mean in Hindi the ghatakta jo hai, that would be slightly more, but there's no reason to panic thinking that it's going to be any different that we are going to manage. The approach is just the same. That is social vaccine, which we know very well today. It's just that the distance is just getting wider from 2 meters to 4 to 8. It goes on, but there's nothing to be scared of. It's not that the aerosols are floating all around and you can't go out and breathe. So, and that's one. Number two, while we are talking about the newer strains coming and the challenges with it, the good news is that we have learned a lot during this period. We also learned to avoid certain drugs and therapies and certain notions. And at the same time, we have now understood that it is not the disease, or it's not the virus, it's our response to the virus which is killing us. So it's the immune response and the kind of overwhelming response which the body can then not take. So it's sort of the insult is small, but the damage is huge because we respond in such a way that we cause ourselves damage. We have also realized that you can actually pick up the bad from the worst cases, and I wouldn't call anyone a good case. So basically, there is a lot of scope for, so many articles have come out in no hurry, and we are very familiar with the WhatsApp University where everybody gives some information or the other. But it is not about following what is evidence-based. It's not about who is saying. It's about evidence-based. It's about what evidence is supporting. So evidence doesn't say that it's going to be disastrous. Even the UK strain was considered to be a bad one, but they got over that with the vaccine. So I think the approach is not going to be drastically different. It's just that we are now more primed into taking adequate precautions, and we are also probably the health setup. Are getting primed into preparing ourselves for the imminent. You don't know whether there's going to be a third wave or the fourth wave, and the virus is known to mutate. That's the story of a virus. So I don't think we should be thinking too much about which strain and how much is the vaccine going to cover it. The approach remains just the same.
Absolutely, sir. And we're joined by our first caller. I'd like to welcome Ashi from New Delhi. Namaste, Ashi ji. Please ask your question.
Namaste, ma'am. Namaste, sir. So my question is, the real-life data, at least in a few instances, suggesting that there are people who are getting infected by COVID even after taking the double dose. So I would like to, hear what you have to
Got
say
it.
about that.
Got it. I mean, that's very common. And let me tell you, whenever we have to study the population at large, we also look at some sample. We can pick up a sample, and the best sample to pick up is, and which is very representative, is healthcare personnel, because most of them have been immunized and they've received the booster as well. Doesn't matter whether they got the Covaxin or the Covishield. It doesn't really make a huge difference. Now, importantly, please understand, no vaccine. No vaccine means no vaccine. I'm repeating it protects you 100% from infection. So that story is over. It's not that you won't get infected, but part two is important. It's the fatality which comes down. So the severity of infection could be lower. This has been studied, and it's based on some, anecdotal evidence, of course, where you have individuals who are so immunosuppressed that, at the end of the day, whichever vaccine you take, you have to create as many number of memory cells. They have a duration to which they are active, and also your own inherent immunity would matter. Therefore, a lot of you hear about immunosuppressed individuals succumbing to the disease rather than most people. There is adequate data to suggest that those who received the double dose, they got infection, but most of them got a milder one. They had the infection, but they didn't die of it. So all you can look at the as an endpoint of vaccination is, did it reduce the mortality? The answer is yes, in the sense that you have to basically look at whether the individual was immunocompetent. In the simple words, whether he was able to, in response to vaccine, because vaccine is nothing, no rocket science. It's like inducing some kind of an insult which is at a smaller level, and then body builds up the memory cells and also the antibodies against it. But if the body doesn't make it, that is in immunosuppressed people, those on chemotherapy, those who are badly managed diabetes, not all diabetics, badly managed diabetes, or patients who are immunocompromised on account of HIV or other infections. We have a list of them, long laundry list of that. They all are immunosuppressed. So don't imagine a vaccine to provide, an iron dome. It is permeable, but it saves a lot of water from seeping in. But that doesn't mean it'll completely keep you bone dry. So vaccination has definitely reduced mortality. Number one. Number two, vaccination has reduced the virulence of the disease amongst many of my own residents, my own colleagues, my own team of surgeons and doctors. They've got infected second time or third time also because we have no choice. They've got a milder infection, which happened for a couple of days and they were fine.
So
So
absolutely.
that's what the vaccine achieves.
Yes, I hope that answers your question, Ashi. Thank you for joining us. We're now joined by another caller, Shubham from Mumbai. Namaste, Shubham. Welcome to India Science. Please ask your question.
Hello, ma'am. Hello, sir. Sir, my
Hello.
question is, I would like to what are the scientific reasons for the increasing the gap from 4 weeks to 8 weeks for Covishield?
Okay.
Very good question. And Shubham, that is. There have been some recent observations, studies, that there was a lower incidence of hospital-acquired infections, morbidity, hospital stay, severity of infection in those who got the second dose with a gap of about 12 weeks. And let me tell you, when I got both the doses, it was with a gap of 4 weeks because that's what was recommended at that point of time. So I'm not trying to take away from what was done then and I now start panicking. Oh, I should have taken it a little later. Common sense says that it'll totally depend on, when do you need a booster? Once you've primed the system and you're getting to a level and then you give a boost so that you get to the optimum level. There is enough data to even suggest, and there are some vaccines like the one Johnson Johnson vaccine. They were all meant to be single dose only. Now the second dose is just adding to that another 10%, 15% of security. But there is an observation that it is more beneficial, and there is limited data to suggest in this short period you cannot have the properly conducted, robust, randomized control trials. But there is reasonable evidence to suggest that with a little gap more, that is what I told you. Now that's why they're recommending 3 months, and that's why you're asking a question, and that's why I said it's a very good question. So there is a slightly better outcome. Now, if you're asking me what is the scientific basis to it, then you'll have to beat the previous scientific basis. Usually, it doesn't depend upon the time gap. It's more got to do with the curve when you're going to take the peak.
I hope that answers your question, Shubham. Thank you for joining us on India Science. We're now joined by another caller from Kolkata. Namaste, Ramesh ji. Namaste. Welcome to India Science. पूछिए अपना सवाल.
Hello, ma'am. Hello, sir. Sir, my question is, sir, please explain the new white fungus variant and what are the precautions needed for prevention?
That's another brilliant question. See, we are mostly talking about mucormycosis, which is the black one, and the white one is candidiasis. Now, they have always been there, so they have not come from somewhere. They were always there. Now, why didn't you get it? Because your body was immune. Fungus is nothing but another organism that survives and needs moisture. And importantly, it wants you to be immunosuppressed. Do you know this fungus was found in patients receiving long-term chemotherapy, radiation, etc. Since my specialty is cancer, so I'm telling you with that background. So all those who are immunosuppressed. It was also seen in HIV patients, as I was saying, or patients on immunosuppressants like long-term steroid therapy, etc. Badly managed diabetes. That background you should understand. Now, why is it risen now? See, with COVID, your counts, that is, especially the lymphocytes, they drop. That is called lymphopenia. Lymphopenia means anywhere. Leukopenia means drop in leukocytes. Lymphopenia means drop in lymphocytes. So what is that doing? It is bringing your immunity down. So what is happening to you? From an immunocompetent individual, you become an immunosuppressed individual. When you're immunosuppressed, what is going to happen? You will catch this fungus. And you see, then depending upon many other theories, many people have given various reasons, including some people saying repeated use of a mask with moisture. Remember, fungus grows in moisture. If you hear of the day-to-day, if you go out and see in rainy season, you see the fungi growing everywhere because they need moisture. So, if you keep a mask for too long and you don't clean it up and it remains moist, the fungus tends to grow. And some people also say in the kind of oxygen that was used by some people. So one is not too sure about that. So nobody really knows the final answer, but it's got to do with mainly the immunity. The immunity coming down, and especially therefore, it is observed more commonly in badly managed diabetics, where the lymphopenia is more, I'm talking about the COVID patients, and also those elderly on steroid therapy, on chemotherapy, radiation therapy, etc. So basically, immunosuppressed, made even worse, that is adding insult to the injury. COVID brings your defenses further down, and with the guards down, the risk is high. This last part of your question was, what do you do to prevent it? First of all, if you're a diabetic, your diabetes should be under strict control. Number two, do not, one more thing which I would like to add here is with an absolutely irrational use of steroids. Because, you must have seen many YouTube videos, WhatsApp messages, that two drugs which are serving as magic bullets, steroids and anticoagulants. But they need to be taken when you need them. The steroids, again, not to be taken in a very high dose, which again happens if irrationally used. Optimum under the supervision of a specialist or a doctor who is treating you or a physician. When do you take it? For somebody who's got no drop in the saturation, who is doing well otherwise, there is no indication at all. And a lot of them have received steroids. So what are they going to induce? In the first part of my answer, I told you, it's an immunity which is down. And if you put the patient on steroid therapy, irrationally, you're going to achieve the same. You're going to get the same bad outcome. So irrational use of steroids, bad hygiene, especially the oral hygiene, it is usually affecting if it's from the nose, it can go to the brain. It can affect the eyes, and you can lose your eye, and it can get into the sinuses. It can go down. It's basically in this region. That is why a lot of people are thinking that this could have something to do with the masks which you're using. If you don't wash them, if they're not clean and they're not dry, if you're using a mask, put it out in sun for some time, at least for half a day or one day, to take care of its moisture and also the fungus, etc. I hope that answers it.
I hope so, Ramesh, and it is important to even throw your mask after 2-3 days and probably pick up a new one. Doctor, we have another question on the YouTube channel. The caller is somebody called Vivek Shukla. I'd like you to take this question. He's talking of some yellow fungus that has been in the news in the last 2 days.
Yeah, and nothing to be scared of. It's got the answer remains just the same.
Right.
No, don't start counting on the numbers that you have. The fungi exist like we exist. They have so many species. When the immunity is down, you develop them all over. And it's got to do, the answer that I gave in the first question remains for the second. Now, please, for God's sake, it's very important. It's a good platform to convey. Don't go chasing these rare things that are happening around. Remember, common things are common, rare things are rare. So importantly, understand, if your immunity is good, if your infection is mild, if you don't have lymphopenia, and if you don't take steroids without advice or, wrong for a long term, it is not going to happen.
So we're joined by another caller, doctor. It is Rahul from Nagpur. I'd like to welcome you, Rahul. Welcome to India Science. Please ask your question.
Sir, my question is, what are the multivitamins that can be taken to boost immunity, and should we continue even after getting vaccinated?
See, first of all, understand, if you look at the evidence, I've read a few articles, and in fact, when I edit a journal, so where I got an article on vitamin D, which is very, very interesting. They found that it actually is protective against all viruses. And vitamin D is in plenty in this part of the world because we have sunshine. Do you know, they kind of correlated it with the flu that happens in the West in the winters because there's no sunshine. So they link it to vitamin D. So there's one vitamin which to a great degree has been proven. And they say, you know what, vitamin D is not, what is a vitamin? Since you asked the question, it's a vital amine. So it's put together as vitamin. Amine is amino acid, which is a part of protein. So it is also important to understand it functions like a steroid, and it can go right into the cell and take care of and protect you. So I'll keep it short. So vitamin D is beneficial. All multivitamins, B complex, etc., they take care of your, the commensals that grow in the oral cavity. They make it a point that you do not develop infections in this region. And then importantly, they are the ones, they provide the protection in general. They support your immunity. Now remember, all enzymes which are used for digestion and for any functioning, they are all proteins, and indirectly vitamins contribute the same way. Remember, COVID is a catabolic state. In a catabolic state, which means there's a fire burning, and it's burning your essential parts of your body. So you're losing your vitamins too. So therefore, vitamins, especially as I mentioned, the entire B family, vitamin C specifically, because in the intro also it was discussed chewing the tablets. Vitamin C is protective in general against most infections. It's an immune booster. Whether you take it in the form of a lemon, orange, or the warm local preparations, it's going to be beneficial.
Absolutely, sir. And my recommendation here, in spite of, you have such an eminent doctor seated with us, is that 1000 mg of Lim C is what keeps you going during this time. So go ahead and have that.
Absolutely. And you just said it. I supplement that. That's also that's vitamin C that you should chew, and you will be happy. You will chew the virus with it. So the virus would be dead.
Absolutely, which is why I put that in the intro, as you rightly mentioned.
I agree.
Sonali from Mumbai. Namaste, Sonali ji. Please ask your question. I'm sorry, Sonali from Gwalior. Namaste. Welcome to India Science.
Thank you, ma'am. So we do not have enough vaccines for 18 to 44 years. So I just want to know what, according to you, is the solution, because the virus is already mutating and we might have a third wave.
Can you repeat your question, please?
Sir, my question is, like, we do not have.
The call is dropped, sir. If you permit, I'll tell you the question. She's asking
Please.
18 to 44 years, shortage or paucity of vaccines. And as she looks at it, the third wave signals, or people have been talking that it might impact the children because they have not been protected by vaccines. So what is your, what are your thoughts on the matter? Please share.
All right. Thank you for that question, and sorry I couldn't take it. Well, the answer is it's very simple. It was never, never. I mean, it's a wrong myth to believe that children don't get infected. It's just that they have an immunity, and it depends exactly on the immunity. Now, the important aspect of the children getting it is that with children, the management in the hospitals and the wards and the COVID wards must understand we have more patients than we have doctors. This is a very important aspect that we need to be discussing anyway. So we will need parents to look after the children, and in any case, when it's a neonate or it's a small baby, we need the parents or the mother to be vaccinated too. Now, but there's no need to be scared. The new strain is going to be especially infectious for children. I don't think that's going to be any different from what you have seen just now. I personally think the same principle applies. It's not that children were never getting infected. They were getting infected even in the West and UK and US. I was in touch with lots of programs that happened, including the various webinars with the American College. So I don't think there is a reason to panic about it. The vaccination drive is on as long as or till such time that we don't get the herd immunity. The risk is always there, and there's no point thinking about the imminent something, thinking that it's going to be negative only. By that time, we would have vaccinated many more people. So hopefully, even though the wave might come and go, because nobody really knows, or everybody's speculating, but it can come, and it's good to prepare for it. But there's no point getting scared of it. We just need to prepare exactly the same way. In spite of whatever vaccination you do, the two things that are going to work, what is your immunity and the social vaccine. So you need to take care. Now, in the US also, they're struggling to convince people that you must put on the mask to keep the social distance. We have the same problem here. With such a major and such a massive problem, we cannot only be the state or the governments that manage it. We need to be taking that responsibility.
Absolutely.
Now, don't look for
yes.
one thing that does not happen. Because it didn't happen, therefore we'll face the trouble. That's not alone the cause. Vaccine is we were the first to start with it. We are such a huge population. Do you know we have done more than one country would do, but we are still such a large number of people. Volume is our strength, but also our weakness. So
Absolutely,
when we keep
sir.
looking at it, you should also look at what we have achieved.
19.50 19.50 crore people vaccinated as of now today. That is equal to a whole country, as Doctor just now added. And also something that you said, I do resonate with that you really can't wish away the pandemic or wish away the waves, but you have to really act and be prepared, social vaccine and all other precautionary measures to be taken, because the virus is not going anywhere. I think that is something we need to live with, and it will keep mutating. Meanwhile, we have another interesting question on the YouTube, sir. Harshit Bhati, and he wants to know that if someone over 50 has got a reaction from a medicine called Septran or tetracycline, one of these two, in that case, should he go for the jab?
Well, it's a tricky one, but I've seen this was one of my patients, and a lot of people have some allergy or the other. But to be on the safer side, they would be kept with an anaphylactic tray that is ready, and it has to be done under the supervision of the center where you go.
Absolutely,
It's a proper protocol, and it's not that it is impossible, because even that's true of many specific scenarios. But allergy, by and large, if you are asking me a take home,
Yes.
and if you're asking me one answer to the question, because there can never be one answer, and I always say that always is always wrong, and never is never right. So we will most probably be able to do that. It also depends what kind of anaphylaxis or reaction was it. Sometimes the reaction is very mild, so that's not usually taken very seriously. So there is a history of the kind of reaction you had with the drugs that you mentioned. Otherwise, some patients have a tendency, some individuals have a tendency to be allergic to just too many things. In that case, one has to take that precaution. And there is an anaphylactic team that takes care of it at the center.
Absolutely, and you could perhaps go in for a teleconsultation with the doctor concerned and take this further. Meanwhile, we have another caller again from Gwalior. So, lots of people joining us from Gwalior today. Sumita from Gwalior. Namaste. Please ask your question, Sumita ji. Welcome to India Science.
Hello, sir.
Hello.
So a week back, I took the vaccine, and then I started noticing a little bit of tenderness and swelling of breast. So I mean, is it like a simple swollen, lymph node kind of a thing, or is it something to be, beware of? What should I do? Should I go for some kind of a checkup, or should I just...
There are two different things you're saying. You received the vaccine, and it was in which arm, left or right? Left arm. And you have a node in the armpit, or there is a swelling in the breast? Because I couldn't understand.
I think she said swelling in the breast, sir.
All right. So it is known with most vaccines, there could be some reactionary lymphadenopathy, we call it. It will settle down, but sometimes we try to attribute everything to that little jab you received. It's a very innocent vaccine. Most people don't have a very serious side effect, barring some pain in the arm, which will remind you of the shot, and a little bit of fever, which is, it's entirely my thought. It's a good news because body is responding, and that is what is true of most vaccines. And some reaction, even with BCG vaccine, you get a node in the axilla, or you can get some, in response to that you may have. She was trying to say in the armpit or in the tail of the breast. Therefore, to get a tele appointment and get it sorted, it should not be that you kind of attribute everything to this, because there could be a new problem that you got. So I'm not trying to simply put it under the carpet, but important thing is it is possible to get a very mild reactionary lymphadenopathy or lymphadenitis as they call it, which is reactionary, and mild inflammatory features around, but it settles.
I hope that answers your query, and now we have time for one last caller. We're joined by Mr. H.B. Sharma from Ghaziabad. Namaste and welcome to India Science. Please ask your question.
Yes, madam, my question is, are the current vaccines effective for cancer patients?
Well, should I take it?
Yes,
okay.
Sir. Yes, sir.
Yeah, you should know. Your question is put awkwardly. I'll reframe it. Will they be equally effective in cancer patients? Otherwise, going by your question, one can also understand that will these vaccines work against cancer? So that's I'm trying to clarify. They have nothing to do with cancer. Now let's come to a patient who's got cancer. I get innumerable number of calls from my breast cancer, head and neck cancer patients that I've operated in last so many years. They're absolutely fine, cured. It's 15 years post-surgery. They're saying, can we take the vaccine? Well, please understand, if you don't have an active disease right now, and you are under control, what we call as remission, you can take the vaccine. Part 2, will it be beneficial? Now, they are as good as a normal patient. If you are on some immunosuppressive therapy, which is what we started with in the first place, if you're suppressed by therapy like chemotherapy or any other hormone therapy or radiation therapy, then maybe you're not ready to create or produce antibodies, because vaccine is not going to be acting by itself. It is going to stimulate your body's immune response to identify the virus when it comes in contact with the cells and to reject it. And that's what is possible even in a cancer patient if he's not on some therapy, or there is a period in between when the counts are normal, and according to his oncologist, it is an immunocompetent individual. He cannot be like a normal individual, but it's absolutely indicated in cancer patients also when they're treated of cancer.
I think we're absolutely out of time now, and we have so many questions pouring in. So I'd like to request you here to please join us on more such conversations. And in the end, I'd like to thank you, Dr. Chintamani, for joining us on this. And with this, this is a wrap on this edition of our phone in. So mask up, India. Stay safe, stay protected. Keep watching India Science. Namaskar.